Senator from West Virginia.
Yes, Mr. President, I would like to ask that we vitiate the quorum call.
Is there objection? Without objection.
Thank you, Mr. President.
Senator from Virginia.
Thank you. Mr. President, I'm here today on the floor I want to thank the ranking member of the full committee for his good hard work on this bill, certainly Senator Shelby and the subcommittee chairs. And we're here to talk about some of the important issues in this bill and the fact that how consequential really this bill will be and has the potential to be. I mean, we're encompassing both defense and labor HHS, both of which passed out of our committee a few weeks ago with bipartisan support and a lot of input from members in the process. Bills of this magnitude deserve to be debated on the Senate floor like we're doing today. So I'd like to first address the defense part of this measure because I think it impacts not only our standing here and our military here, but also has a global impact. President Trump has made rebuilding and strengthening our military one of his administration's primary objectives. And this bill helps him do exactly that. This legislation invests in programs and projects and technologies and capabilities that will strengthen our nation's military. More importantly, it invests in the people behind all of these efforts by including a 2.6% raise for all of our military. That includes our National Guard. Our National Guard presence in West Virginia is essential not only to our nation's security, but to all the core values and the core strengths that Guard brings to the state of West Virginia. All of these men and women deserve our support and our commitment to provide them with what they need to defend a freedom both here and abroad. Of course, the legislation under consideration doesn't just focus on the military. It also focuses on another war being waged right here in our own country, and that's the fight against the opioid epidemic. Under the leadership of Chairman Blunt, and he's been fantastic in the committee, the Labor HHS subcommittee has made this issue a top priority. And I could not be more grateful, more proud, but even more importantly, more hopeful. We saw the statistics come out last week of the over 70,000 deaths across the country. And it's deeply troubling that how to get the best handle on this very difficult problem. Over the past 4 years, we've increased funding for this effort, fighting the opioid crisis by more than 1,275%. But we haven't done this blindly. We are just not throwing money at the problem. I think we've been very thoughtful, as have our partners in the state and local areas. We focused on treatment through our community health centers. We focused on prevention, working with the CDC. We focused on recovery through our workforce initiatives. And we focused on research at NIH, where hopefully NIH can develop a non-addictive opioid treatment, which will, I think, be a major breakthrough for this problem. And we focused on directing funding to the states to meet the local challenges through their state opioid response grants. We've also focused on the ripple effects of this epidemic, including the impact on families and children in foster care. These are all important resources and much needed. But I want to call special attention to our work and something that's extremely important to my home state of West Virginia. In the previous funding legislation, when we were dealing with this problem, I authored language with Senator Shaheen. We had language directing funds in the state opioid response grants to those states with the greatest needs. Unfortunately, the unfortunate metric in my state, and certainly in your state as well, Mr. President, we have states with smaller populations, but we have some of the biggest impacts, the highest addiction, the highest overdose, and the highest death rates across the country. This has enabled us to focus more funding on those states that are more deeply affected but don't have the population to drive the formula funding to have enough formula funding in the state to meet our needs. Just a few weeks ago, our state Department of Health and Human Resources released a preliminary numbers that in West Virginia, we had almost 500 opioid-related deaths so far in West Virginia. And while this is the most devastating statistic, when it comes to West Virginia and the opioid epidemic, it's not the only one. It's not the only one that we need to look at. we are seeing increasing number of children in foster care. This is impacting the entire family. There are more grandparents and great-grandparents who are raising their grandchildren and their great-grandchildren. Our state has an increased need for treatment facilities. We have more babies that are requiring neonatal care, as well as the services as they grow. I've seen these needs firsthand. This has impacted our entire state very deeply through visits to the facilities, conversations with families, counselors, recovering addicts, healthcare professionals, and first responders. And I can say, living in a smaller area, more rural area of our country, I know families personally that have been impacted by this. It's heartbreaking how many people need help, and this bill, I think, takes major steps to help delivering that. While the opioid epidemic is a very significant focus of labor HHS, I want to highlight some of the other valuable investments. One that is a very personal priority of mine, and I know Chairman Blunt as well, and many of us, Senator Collins, who's here today, is the funding that we provide for Alzheimer's research. Both of my parents died in the last 4 years, both of them with severe dementia and Alzheimer's. It's probably the saddest, hardest thing that we as a family have ever had to face. And I understand the emotional, physical, and financial toll it takes on patients and their caregivers and families, because a lot of the caregivers are family members. It is a devastating disease, which is why I've been such a supporter of a wide range of Alzheimer's-related legislation. With this bill, we have surpassed Chairman Blunt with his leadership, $2 billion milestone when it comes to Alzheimer's research. And that isn't just for research, that's also to figure out the best way to help our caregivers. We've also, in this bill, directed other priorities, help for other priorities. In a state like mine, a rural state, community health centers are critical. Apprenticeships grants, I was just with the plumbers and pipe fitters. Apprenticeships are absolutely critical to the workforce that we need. The IDEA program at NIH, which drives research dollars out to universities away from the main campus of NIH. Certainly our colleges and universities are taking advantage of this, in particular West Virginia University. We also fully fund, and I'm very excited about this, with Senator Reid, our bill on childhood cancer. It's called the STAR Act. We introduced it, we passed it, but this will expand opportunities for childhood cancer research, improve efforts to identify and track childhood cancer incidences, and enhance the quality of life for our childhood cancer survivors. Many of them have cancer and have treatments at their younger years, but what happens to them as they enter into their teenage years, their young adult years, if they move into family life? There are impacts that impact our childhood cancer survivors all throughout their life. So I'm really pleased with the efforts that we've made there. In short, this legislation aims to improve the health and well-being of every single American. When it comes to the Department of Labor, very briefly, this is important for us in West Virginia. There is a training program there for displaced coal workers and coal miners. We've refunded that. We've pushed more funding to that, I should say. Refund sounds a little confusing, I think. And we've also increased the maximum amount for Pell Grants. So these are just a few highlights of this piece of legislation with a few critical resources that I think will make a big difference. So I know this bill will benefit my state of West Virginia because it recognizes the needs and opportunities facing our state and nation. And it provides the resources we need to seize those opportunities. And it represents the first time in a long time we've worked together, we've worked across the aisle, we've been able to have our say as members, every single one of us, into where and how we want to see both Defense and Labor HHS, these enormously impactful agencies and how they impact our lives. So for me, that's a major victory here, being a member of the Appropriations Committee. So I want to extend again my gratitude to the subcommittee chair, Senator Blunt, and the ranking member, Senator Murray, and then our two major chairs, Senator Leahy and Senator Shelby. It's a good day here, I think, on the floor of the United States Senate. Thank you.